WCLN 1170 Radio and Starvision Cable Channel 16 are pleased to present We Should Know, hosted by J.W. Simmons, an upbeat, informative look at people, places, and issues facing our community. This education-based analysis of issues will remain positive and informative as we consider closely what we should know.
Ladies and gentlemen, welcome back. You are listening to and watching We Should Know on Starvision Channel 16 TV, also WCLN 1170 AM. We want you to take a look at us on Facebook at We Should Know. Also email us at weshouldknowedu@gmail.com. And I want to thank folks for particularly emailing us and making comments concerning today's program. As you know, it's somewhat of a somber program. It's a very highly concerning program. The tragedies that we have seen in our communities recently with suicides and murders, and particularly since Connecticut's horrific tragedy with the children, it's something that is kind of hard for us to get our head around. And quite frankly, what we've done today is pull together some of the experts in the field of mental illness, some folks that's going to help us better kind of understand what's going on with mental illness. And at the table with us, we actually got three people with us today, and Kathy Baker is one, and Angela Inman is one, and Courtney Boyette, and we're going to bring Angela on a little later in the show. But to start with today, we've got Kathy Baker. She's the communications officer. And Kathy, I want to turn to you, and thank you for being here, in fact, both of you for being here, but kind of get to the point here this morning. This tragedy that we're facing in our communities, in our country, literally in the world, is hugely impacting. And one of the three sectors of concerns that has arisen just over the past 72 hours has gone from everything from gun control to security of a school building. And one of those concurrent revolving issues is mental illness. Now, you represent, as a communications officer, Eastpointe MCO, Managed Care Organization. Yes. That's a pretty large organization. Tell us about that a bit and kind of get us on track here and help start this discussion off.
Well, Eastpointe is the local mental health authority that has oversight for 12 counties for public mental health. And those counties are Bladen, Columbus, Duplin, Edgecombe, Lenoir, Nash, Greene, Robinson, Scotland, Sampson, Wayne, and Wilson. And of course that includes the area here in Sampson. We're responsible for having a network of providers to address the needs of consumers in this area, and also for authorizing services. We'll be managing the public mental health care services. My purpose today is to get the word out about that. We want people to know, and we thank you for the opportunity to let people know, that help for mental health is available. If you have a mental illness, intellectual developmental disability, or a substance abuse issue, there's one number that you can call in our area to get help, and that number is 1-800-913-6109. That's a toll-free, cost-free number for people to call. They'll be connected to a clinician who can triage that and direct you to the right place to go. We also have a website, www.eastpointe.net. That's www.eastpointe.net. And on that webpage, you will find a tab for consumers. And that tab lists some great resources. One of those is our access brochure about how to get help. And it goes through and lists the fact that you can call the number, but it tells you what to expect. It also tells you that we have some walk-in clinics. So, and they are located throughout our service area. We have one in Duplin County at New Dimensions Group on West Ridge Street in Rose Hill. We have one in Lenoir County in Kinston. We have one in Nash County in Rocky Mount, in Robinson County in Lumberton, in Wayne County in Goldsboro, in Wilson County in Wilson, and most importantly in Sampson County, Comwell Health at 306 Beacon Street here in Clinton.
That's Beacon Street, located just across from the pharmacy there. There's actually two pharmacies. I think it's across from Clinton Drugs and the other pharmacy there on the corner. Right. So it's located almost in that quadrant.
Yes, so that is a walk-in clinic that you can go through from 8 to 5. But 24/7, 365, you can call our call center, that 1-800-913-6109 number. Day or night, holiday, weekend, workday, whatever time, you can call our call center number to get help.
And Kathy, a lot of folks, when we give this number out, and we're going to be doing that quite a few times during the show today, we want them to write that down, because there's a time going to come when they're either going to observe something, feel like there's a need for somebody to know something about a concern or an individual, and unless it's a 911 emergency, this number can give them that information, and they can get help at that number.
It can. And regarding emergencies, and Angela will come on and she'll talk a little later about the emergency response, because Angela works for one of our provider agencies, one of the agencies that is in the Eastpointe network of providers. And if there is a need when you place that call to our call center, they will connect you with our mobile crisis. They'll make sure you get that connection. Most of the time, the call is going to be a routine call, and we're going to be able to set you up with a provider that's going to be able to start the process with you. But we do not want people to call that number. And for our hearing impaired folks, there is a number, our TTY number, which is 1-888-819-5112. That TTY number for the hearing impaired is 888-819-5112. JW, you alluded to that with recent happenings here in Sampson County, and now with the national event that has taken place just this past Friday in Connecticut, that it's really an issue that we have to discuss. And I think that mental health is something that everyone should be aware of. You should be aware that there are often needs, and that there is a place to go to for help. Eastpointe is that place. There are many places, but Eastpointe is a place here in Sampson County that you can call anytime and get directed to the help you need. And we have to get rid of the stigma of seeking help. One of the things that we do want people to know is that many times people who need help don't get it because of the stigma and the shame of seeking help, but that only makes things worse. And the vast majority of people with mental illness are much more likely to be victimized than to be victims. But there's always that case where, they're much more likely to be victimized than to victimize someone else. But there's always that chance, so we have to be aware. One of the things that Eastpointe is doing is we're connecting with our communities, and that's why Courtney Boyette is here today. Courtney is the Community Relations Specialist for Sampson County. She is your go-to person to work with all of your local partners.
Courtney, I want to thank you for being here. Thank you for that introduction, Kathy. Courtney, it's kind of introducing you a bit. Just kind of tell the folks in the area that's listening, particularly Sampson County, but again, we cover quite a few counties. But for folks maybe listening in Sampson County area, how do they reach you? And let's talk about Courtney just for a minute so we can get to know you.
Well, my name is Courtney Boyette, and I am the Community Relations Specialist over here in Sampson County, and I also cover Lenoir County. I'm the person that you can contact, any local agency, any individual family that might need assistance and more direct information about the system. You can contact me, and I can certainly get you going in the right direction.
Now, can they reach you by calling this toll-free number, or is there another number that's better to reach you?
Yes, you can certainly call me through the 800 number, and then my direct number is 919-587-0333.
0333. 587-0333. Now, Courtney, you've got somewhat of a background in mental health. How long have you been doing this, and what are some of the areas that you've worked in mental health?
Okay. I've worked in mental health for about 10 years now, and my background's emergency mental health and substance abuse. So I've worked with a lot of families in crisis. I've taken a lot of suicide calls, worked with a lot of families over the years, because sometimes we find that people want help, but they don't know how to get it. And so a lot of times families call us and get information of how to get their loved ones help.
Well, and we're going to get into more in-depth about just that subject, suicides. I want to kind of get back to Kathy. Kathy, we've got a couple of minutes here before we take our first break. Should kind of give us a bigger picture idea. the whole funding issue with mental health now obviously is a concern. We've seen budget cuts on the national level. We see potential budget cuts on the state level. How is this impacting the service that you render and that Eastpointe renders to the local communities, especially as it relates to suicides, those kinds of things?
Well, you know, a couple of years ago, one thing that we fought very hard for in North Carolina was mental health parity. And to be sure that we got parity for mental health services, so it's paid for the same way that your physical health is paid for, because you cannot separate the mind and the body. We are one person, and we have to be sure that we give holistic care. That is why we're looking at more and more, and especially with healthcare reform, with having the combination, co-location of mental health and primary care providers. That is the way to go. We actually, one of our Eastpointe partners that joined together to form Eastpointe Southeastern Regional, we did a grant a few years ago to do exactly that. And that is the way that the nation is going. In regards to funding, we have to let our legislators know that we're not the place to make the cut. That there are lots of needs, but that mental health is an area that we have to pay attention to. That I don't think people would consider cuts to physical health when it comes to heart disease or diabetes, and we certainly don't need to make it there. We need to always be advocating that we are able to provide quality care for people who need it.
And I think that's important, and one of the things that's going to be elevated is this whole idea of mental health and its involvement in the communities, and again, trying to remove that stigma,
right.
And you do that.
And Courtney is the person to help you with that in Sampson County. She can do trainings at different human service agencies, civic groups, faith-based organizations. We really have to get knowledge about mental health, the need for mental health, how to get services for mental health out to our community partners. And so Courtney can do training. She can help people become advocates. There's lots of information that Courtney can help with.
Kathy, I want to thank you for being with us today and also bringing this oversight to us. We're going to take our first break, and we'll be back in a moment. We're going to be talking with Angela Inman and Courtney Boyette, a more in-depth look at horrific kinds of problems that may be occurring in your community. Stay with us. We'll be back in a moment. Ladies and gentlemen, welcome you back. The name of the program is We Should Know. We're coming to you on Star Vision Channel 16, WCLN 1170 AM, worldwide on oldies1170.com. You can catch us on YouTube and just type in We Should Know, EDU. You'll pull up this show and a number of shows that we have done that's being uploaded to YouTube, and we hope that you glean some information and knowledge that's beneficial to you. We're talking about somewhat of a somber note and a huge tragedy that is befolded here in our community and literally in the world as we know it, and that is the community of Connecticut. These kinds of things unfold on a micro level throughout our country on too often a regular basis. I want to thank Kathy Baker, the Communications Officer for Eastpointe, for being with us in the first part of the show. Today, we also have with us Angela Inman. Angela is the Mobile Crisis Manager, the supervisor for that unit, and you've met Courtney Boyette. Angela, thank you for taking your time to come in and be with us today.
Thank you for having me.
Talking about these issues of suicide, and we can, either one of you can take this on, but first thing I want to do is Angela, kind of tell folks what the mobile crisis person is, and tell us a little bit about you, because this may be a new term for people. They may be hearing that and going, mobile crisis, are they part of a police department? Are they part of a medical unit? What are they part of? So tell us how that operates so we can be a little bit familiar with that.
Absolutely. Well, I'm a licensed clinical social worker, and I supervise a team of 22 individuals, and together we cover 8 counties in the Eastpointe area, including Sampson and Duplin counties. And what our team does, and I'm sure that it's probably unfamiliar to a lot of people in this state, because mobile crisis in its current form has only been in North Carolina since 2007. So we're a relatively new service to North Carolina. But we go to wherever people are in a crisis. And usually it's just one of our mobile crisis counselors responding to a crisis. If it's at night or late in the day or in a private home, a lot of times we have a law enforcement officer accompany us just for safety, for our safety and for the person's safety that we're going to see, because they don't know us either. And we go on site. We bring the mental health service to that individual where they are, when they need it. There's no out-of-pocket cost for folks to access our service. If they have insurance, if they have state insurance, private insurance, no insurance, mobile crisis is available to anyone, regardless of all those financial factors. Anyone who's in a crisis in Sampson or Duplin counties can access mobile crisis services. We're very easy to access because we are contracted. We are a provider for Eastpointe, so you can call the 800 number that Kathy referenced earlier.
The 800-913-6109.
That's right. You can call that number. You don't have to know the term mobile crisis in order to access our service if you need it, because the clinicians that answer the phone there are trained to recognize when someone needs our service, and they'll send us out. When we go on site, we don't have an ambulance or a police car. We come in plain clothes in our personal vehicles, and we find that's less threatening to folks than if we showed up and let the entire neighborhood know that we have lights and sirens or something. So we come just plainclothes folks, and we try to figure out what the crisis is and what type of plan we can put into place to keep that individual safe. We try to keep folks out of the hospital if absolutely possible, but our biggest concern is to keep people safe and to make sure that they're linked with the correct service. You know, and the mental health reform in North Carolina over the past 10 years has been very confusing for some folks. So a lot of times when we see people, they just don't know what to do or where to turn. So we can help put a small plan in place until they can get connected to some ongoing treatment. And I think it's important to note, even though we're a team and there's 22 of us, 22 people aren't going to show up at your house if you need mobile crisis service. It'll just be one mobile crisis counselor and possibly a law enforcement officer.
You know, I think Kathy Baker pointed out in our first segment the whole change kind of thing that's going on with mental health now, and the refocus. This situation that occurred just Friday in Connecticut, there's already conversation that it's going to again look at mental health as one of those things that really needs additional attention. And what you're doing as a mobile crisis person, a lot of folks that are probably listening or viewing this program today are thinking, I've never heard of that, because it just hadn't got out there that much. I want to switch kind of over to Courtney. Courtney, part of your role, from what Kathy explained, is that you're dealing with the idea of getting the information out to the public. So I guess what I'm saying or seeing from you is that you're going to be a conduit of making sure people know more and understand more about what mental health is and the dynamic of that. What is your strategy for doing that?
Well, my role is to be specifically in Sampson County and to work with the consumers that are in that area along with the agencies and make sure they understand how to access services such as mobile crisis. There have been a lot of changes in the mental health system in the last 10 years in North Carolina, and it has gotten a negative name, and we're trying to get out there and let people know mental health is still available. It might look different. It might be accessed different, but we can still get you the same type of services that we always have had available in North Carolina.
So if somebody calls 1-800-913-6109, they may be a person that's looking at a program at the Kiwanis Club, Lions Club, Rotary Club, whatever. They can get you through that number. They just tell them, look, I'm trying to reach this person with Eastpointe that talks about mental health issues. Can you connect me? And these folks will do that.
Mm-hmm. They'll connect directly to me. You know, I'm in the office, but I'm also in the community. My role is to be in the community and to work with everyone.
Now, do you connect and work closely with hospitals, the medical side of the house, the clinicians that work with medical issues. One of the things we talked about again in the first segment was this whole holistic approach to medicine and to medical help is both the mind and the body. So do you connect well with the doctors and the medical doctors? They know who you are, and are you working on making sure they know who you are and they know how to reach you?
Yes, I think that's really important, because one thing I've seen over the past few years in mental health is the medical doctors don't know how to always address the mental health or substance abuse issues. So that's kind of our goal, to get in there and educate them a little bit more about the services that we have available, so we can connect the consumers and get medical and behavioral health issues all treated together for the person.
So let me ask you this question, Angela. As you look at crisis and crisis response, let's talk about it from the sense of severe kinds of, and I'll use the word psychosis, it might not be a proper term, but psychosis in which a person is going to take their own life. Is there an increase in that? Are you seeing a lot more need for emergency response in that area? And is it coupled with other kinds of related addictions, for example, various kinds of drug addictions? How does that unfold?
You know, I don't have statistics with me, but from our team's experience, we are seeing a lot, an increase in individuals that are having suicidal thoughts or thinking about attempting suicide or have attempted suicide. I think part of that might be from waiting to access help, waiting until it's an acute crisis before they seek help or let anyone know. A lot of that, and this is conjecture on my part, but it might come from the stigma that still exists in our society about seeking mental health treatment. I think the more we can, as a culture, move to viewing suicide as a public health problem instead of a crazy person problem, the more likely people will seek help before they do something impulsive and often very tragic.
When you look at that, Courtney, from your perspective, what in your role do you do to help reduce that sense of stigma and explaining to folks, you know, mental health is something that needs treatment, mental health is something that there are professionals there to come in and help you? How do you get that message out, and what kind of response have you been getting from the community?
Well, I think a lot of times what I need to do is make sure people understand the process once they go through access and get the appointment, what to expect when they walk through the door. That's been the biggest thing people tell me is the hardest thing to do is to walk through the door for the very first time and get that help, and not knowing what to expect, who they're going to see, that type of thing. So I think it's always helpful to break it down and make it as simple as possible so they understand the process, what's going to happen when they go to their very first appointment. So I think that's very helpful in working with families, because if they're new to the system, they don't know what's going to happen, you know, at their very first appointment and that type of thing.
Well, let's talk about that process just for a minute. You know, we've been given this number out, and I'm going to keep trying to put this out there. If folks will, and I want to get a pen now as they're listening to us. But it's 1-800-913-6109, and they call that toll-free number, and they say, is there an access point? Kathy Baker in the first segment pointed out, you know, there's one here in Clinton on Beeman Street, across from Clinton Drugs, right across from the corner from the Wellness Center. They go there, they walk in the door, and they say, look, you know, I've been very depressed, or they just walk in the door and stare at somebody. What should they expect to happen?
Well, they would be linked up to a therapist that's there on site that can do an assessment and determine what level of care that they need. And like Angela said, we try to keep people out of the hospital, but sometimes we do have to put people in the hospital for safety, and we can help link them to that process. Or maybe they need to be started on medication, medication management therapy. Whatever their need is at the moment, we can link them to that service, whether it's right there at the walk-in clinic or it could be another service available in the community we can get them linked to.
So they can expect that they're going to get some attention, and something is going to be done with their case if they walk through that door. And they necessarily do not have to dial the toll-free number. They can just walk in off the street. I mean, I guess that's the reason they call it a walk-in clinic, correct?
Yeah, the walk-in clinics are very much like the old mental health centers, where people could just walk in and be seen and see a therapist or a doctor. That's very much the same process that our walk-in clinics operate like.
And in discussion, both off air and on air, oftentimes folks don't get that. But we want to talk more about that when we come back. We're We're going to take another break, and we'll be back in a moment. Ladies and gentlemen, we're talking with Angela Inman and Courtney Boyette. We'll be back in a moment. Ladies and gentlemen, welcome back. We're talking about mental illness, mental health issues today. As we come back on air, I want to kind of remind folks, if you're listening to us or you're viewing us, you might want to pick up the phone and call a neighbor or a friend. You might want to DVR this program. We do replay it at 7 p.m. on Tuesday, Wednesday, and Thursday evenings on StarVision TV. Of course, the program is 2:30 to 3:30 on Tuesdays. So if you're not there or you know a friend, DVR it for them. It's a very important program. It's addressing some of the critical issues of mental health in our communities. And where we are today as we look at the horrific tragedy of what's going on in Connecticut and what's happened in some of our local communities here. We're talking with Courtney Boyette. She's the community relations person here for Sampson County with Eastpointe Mental Health, and we're talking with Angela Inman, who handles a mobile crisis response team, about 20 or so people. Let's start this segment. I want to read you the National Alliance on Mental Health. Describes mental illness as a medical condition that disrupts a person's thinking, feeling, mood, ability to relate to others, and daily functioning. When we think about mental illness, do we always see it in the sense that it is a medical condition, or do we see it, as we've talked about, alluded to, some kind of stigma? And how do we get folks to understand that it's okay to call? It's okay to call this toll-free number and seek assistance. How do we go about that? And do you see a lot of that still going on, that we'll just put it off? Or as you so importantly, I think, referred to a while ago, Angela, that you're not going to have 10 or 12 police cars show up. It's kind of a nondescript response.
I do think that every year we're learning more and more about mental illness and how there's a organic component. There's a medical issue. In the past, we didn't know as much about it, and so it was treated as just this odd family member that we don't want to talk about and we kind of want to hide away. But fortunately, the research community has come a long way, and the medication that's on the market now, it's not perfect by any means, but it works a lot better in helping to manage a lot of the symptoms of several different mental illnesses. So as the community learns more and more, and our nation learns more about how treatment can be effective, I'm hoping that people will buy into accessing treatment earlier, because just as with any illness, early treatment is more effective, and it's easier to treat mental illness when it's treated early.
One of the things that the folks and I get a lot of questions. I have questions emailed. When we have a show, or if there's something traumatic happens, folks will stop and say, "Well, can you get so and so on?" And oftentimes these questions come up related to what they can do. And one of these things in a recent situation in our area where we had a suicide occur, and a young girl in one of our schools here lost her life. The question always comes up, what could we have done? And the preventative idea of these tragedies, are there certain pathways and things that folks need to look for, as maybe says, look, a person screaming for help, but they're signs, they're maybe subtle in the nature of what they do. Is there something there that you can tell our viewers and listeners to watch for? Either one of you.
In that specific case, there's so much that we don't really know about with that specific case, but I do think it's important for people to take family members seriously. When someone says, "I'm thinking about killing myself," take them seriously and help them access help. Don't just say, "Oh, no, you don't mean that," because it's an uncomfortable thing to talk about, and we don't want to go there in our minds thinking that my loved one feels like this is the only way to fix a temporary problem. And one thing that we have learned in research, suicide is preventable. Treatment is effective. one of the myths that I grew up hearing in the community was that if someone really wants to die, they're going to die, and no treatment is going to matter. But we've found that that's just not true. People who receive treatment for suicidal thoughts and depression and psychotic disorders, they do get better, and the majority of folks don't always feel suicidal. Those crises don't last forever. If we can get folks treatment when they are in crisis or prevent a crisis from occurring, then we can hopefully prevent some of these tragedies from occurring. Most of these horrific shootings, what we found and some of the FBI research after the fact has found that these folks were telling people, this is what I intend to do, and this is how I'm feeling, and these are the thoughts I'm having. And for whatever reason, they weren't able to access the treatment that they needed to prevent such horrible things from occurring.
So, Courtney, I think just to kind of segue to you on that, that's so critical for us in communities. Whether it's a superintendent of schools or whether it's a teacher in the classroom or whether it's somebody that walks in a local minister's office and they're seeking help, what would you say to them? Call this number, get assistance, because you're exactly right. All the reports are coming out saying they were screaming for help a month, 6 weeks beforehand, and they were not getting it. So what do you say to those people?
And I agree with what Angela said. I feel like a lot of folks do, they drop hints. There's subtle things that something's not right and that they do need help. And like you mentioned in that case, I think one of the myths I've always heard was that people feel like if you talk to them about suicide, you're going to encourage them to do it. The thoughts are already there. Mm-hmm. Sometimes they're relieved that you're actually talking to them about it and that you're acknowledging that those thoughts are there and that you're trying to get them help. So I think anybody in the community that has contact with somebody that might be having problems or giving those warning signs, that type of thing, ask them, are you having thoughts of wanting to hurt yourself? That type of thing. You're not going to put that thought in their mind that they're going to do it. Those thoughts are already there.
And with our team, a lot of times people are uncomfortable going to seek treatment. So we can come to them. We've been to Walmart in Clinton, we've been to Hardee's, we've been to schools, we've been to homes. So we'll go wherever we're needed. And we sat on a bench. I've sat on somebody's front steps because they didn't want to sit inside. So we're very flexible about coming to meet people where they are and help them, because one of the tragedies of mental illness, just for everyone that experiences it, is that it's very isolating and people tend to feel very alone. So one of the most empowering things that we can do is to help remind people and remind families that you're not isolated. There is help, there is hope, things do get better, and this crisis won't last forever. When you're in the middle of that crisis, you can't think clearly, and having someone objective to remind you of those things, I think, can be very healing and empowering for folks.
And you guys are also facing a huge number of PTSD, post-traumatic stress situations that is being brought back from military deployments and various other things in our communities. And I want you to speak just for a moment to those folks, spouses and others that are dealing with those crises. I know law enforcement has received special training on that, and of course Eastpointe works very closely to offer crisis intervention team training for law enforcement, and a number of officers. I was reading a while back, I think Wake County's got 800 or so officers that's been through the CIT training, so highly commendable for them to do that. When we look at that, how do you deal with the PTSD situation? Somebody calls and they say, well, so-and-so's acting a little bit strange. They stay out in the shed all night to 2 or 3 o'clock in the morning working on something. What are some of the specific things that we look for when we look at these indicators? I'll call them indicators. Some people call them pathways. What are some of the specific things we look for? Let's talk about a couple of those. Either one.
Okay.
With veterans particularly, a lot of times they'll describe to us they're having a lot of flashbacks. They're very uncomfortable in crowds, even in a loud setting. that might trigger a lot of memories for them. So someone who, one veteran that I worked with in the past, he couldn't go anywhere without his weapon, and he was sleeping with a loaded weapon underneath his pillow. And that was a indicator for us that he had some significant post-traumatic stress symptoms, and he needed some help. So just those out of the norm, getting angry very quickly. People seem like they have just a quick temper, things that wouldn't set them off. Children not putting their socks away might just cause a parent to erupt, when typically they would manage that a lot better. So you see a lot of impulsivity, a lot of anger, flashbacks, just not comfortable having anyone behind me because I'm not sure if that's an insurgent.
I was going to say also paranoia.
Very paranoid.
I had a veteran one time that told me wherever he was at, regardless of whether it was Walmart, the grocery store, wherever, he always had to know an escape route in his mind. So it's not like they can turn it on, turn it off. They've lived this way, whether they've been overseas and, you know, in wars or whatever, and they come back, and you just can't turn that lifestyle off. They've got to learn to cope and live in the real world. But he said everywhere he went, he had to figure out where his escape route was going to be. And I thought, what a terrible way to live. I mean, that's got to be hard, you know.
And our staff, our team recently had some training from one of the counselors who works at Seymour Johnson Air Force Base to give us more in-depth training on working with veterans in our communities. We also serve Wayne County in addition to Sampson and Duplin. And I think it's important for us to be able to connect veterans with the specific support that they need and their families need, and for them not, veterans especially have a lot of stigma that they have to address, and they a lot of times wait to seek treatment.
Well, we're going to take our next break. We'll come back. We'll talk about some more of these pathways or indicators and try to get folks up to speed on that. We'll be back in a moment with We Should Know. Stay with us. Welcome back, ladies and gentlemen. We're talking about mental health issues. We're talking about mental illness here in our area, in our listening area. Several counties. I know folks listen to the program and view us on Star Vision Channel 16. This program is also uploaded to YouTube, so you'll be able to go to YouTube, just type in We Should Know EDU. You'll be able to see the program in its full and entirety. In the shadow of a very horrific situation in Connecticut, we're coming to you today to talk to area mental health people about the mental health picture and side of the house as it relates to that. It's hard to fathom the number of folks that were killed, murdered in Connecticut. It's hard for people to literally get their brain around a 6-7-year-old child and multiple gunshots. All these things are being are coming out vividly on TV, and folks are being impacted. We've talked about the idea of people reporting. We've given this number out. I'm going to do it again right now, 1-800-913-6109. That gets the number for Eastpointe. It is a number that you can reach mobile crisis team folks that can come in and help. Angela, that's your group. Courtney, you're there. Courtney Boyette, they can reach you through that number as well. If they want additional information, or if they want somebody to talk to their church group, or they want additional information about any specific aspect, they can call you. The idea that there's not help there, I think, is kind of a misnomer. We've got a walk-in clinic, as Kathy Baker pointed out in our first segment, right on Beeman Street in Clinton, North Carolina. There's one throughout the 12 catchment areas that's accessible to folks for Eastpointe viewers and listeners. Counties that are not part of that 12 counties, there's also resources that's available for them. So anywhere anybody's listening to us today that may hear this program, there is help available. Let's get back to some of the kinds of indicators. And again, everybody's mind is on the kinds of things that has happened here locally with the suicide and death of a 13-year-old girl. Their mind is on these 20 children, and of course the adults as well, but the children just kind of resonates. When we look at those indicators, there was a link that was on the communications, internet, Twitter, that a lady by the name of Lisa Long talked about her 13-year-old child, and many of our listeners probably have seen that or at least heard it because some of the major media is covering her remarks. But she had a child that was mentally ill, that had a condition, again, as described medically. It's a medical condition, but it affects the brain. She mentioned, how she often was concerned that this child, her child, could have done the same kind of thing that Adam Lanza did in Connecticut. How far are we away from that? And what would you say to her now if somebody like her is listening out there and viewing in our area? What would either one of you say to her? What should she do if she has noticed these extreme violent kinds of signs going on with the person that she loves, a child? It could be a spouse, any member of the family. What would you say to her? Either one of you.
I would say to help her son get the help that he needs. Sometimes, especially with children, the parent and guardian is going to have to be present and available anyway. But help encourage them and support them, because there's probably things going on with her son that maybe he feels uncomfortable with, and he just doesn't know how to deal with it. So through accessing services, it can help him learn coping skills, different ways to deal with maybe some anger, some hostility, irritability that he might have, and help prevent the situation before it gets that far along. Obviously, she's seen some things that are disturbing to her that she feels that could be her son, but she needs to get him linked to a system, to a mental health system, and get him in the supports and treatment that he needs.
And one of the things too, as we were talking about that, there should be no concern about cost. It's not, a lot of times folks may say, well, I'd call, but I may have to have $100 down payment or something. Is there an issue with that when they call?
And I want everybody to understand that Eastpointe does get funding through the state, so we are able to help people that don't have insurance. So whether you have Medicaid, Medicare, no insurance, private insurance, if you call our 800 number, we can get you linked up to a provider regardless of whether you have money or not. We want you to get the help that you need.
Angela, you're the provider. You're the person that's going to get linked to. And when we talk about that, we talk about your crisis response. Do you get to those situations when you hear somebody and you're talking to them that you say, I will be there, tell me where you are? It's like you feel this unbelievable rush. You've got to get to that person now, that it's that critical. Because we have had, just in this little town, if you look back historically, situations of really high profile suicides. This is not new. I think the Connecticut thing just has now put it in such a huge light that we're going to be viewing this and discussing it for months down the road, years even.
It really has touched a nerve. I think like you said earlier, having 20 children who have been tragically murdered just has touched the heart of our nation. In our specific community, as far as accessing help in a crisis, we do respond within 2 hours, but because Sampson County is very large, so we try to get there in an hour or less. However, if when we're on the phone with the person on our way there, if we feel like this is so urgent that we might not get there fast enough, we'll call 911 to make sure that person's safe, because safety is paramount. And I would also say, if you're concerned about your loved one, if your loved one has threatened to harm himself or herself in some way, and you're not sure what to do, you can call 911. You can call Eastpointe. If you feel like it's a medical emergency, you can always go to the ER and seek medical treatment. We don't want to take away from that in any means. However, we do want to be an alternate, an extra resource for folks before they get to that point where they've taken an overdose of medication or something to that effect. But I think the biggest thing to remember is to listen. Listen to your family, listen to your loved ones. If they make these types of threatening statements, they want to hurt themselves or hurt someone else, to take them seriously and act on that information. If it's your neighbor, if it's the PTA, soccer mom that you're friends with, whoever it is, you can give Mobile Crisis or Eastpointe a call if you're concerned, and they can send out Mobile Crisis. You don't have to be a direct relative or their guardian for us to come out and just make sure they're okay. And I think that's very important, and to look for personality changes. Someone who used to be outgoing and now they can't do anything except sleep all day, or they're very irritable. They're talking, which you might think crazy, and seeing things that nobody else sees, or hearing voices that no one else is hearing. Things like that, those significant, drastic changes in a person are what you want to be on the lookout for. Obviously, someone who has access to firearms. Firearms are the #1 method of suicide in North Carolina across almost all ethnicities, and for males and females. I think it might be #2 for females. But someone who is threatening suicide, you want to limit their access to firearms. Take them somewhere else, lock them, and don't share the key with that person to keep them safe, so that they're not making impulsive decisions that could end their life before you can get them treatment.
Courtney, substance abuse, drugs, prescription, otherwise, whatever kind of drug, excessive use and abuse of both legal and illegal drugs, is kind of an indicator that there's something going on. Are you finding that sometimes as you look at these cases where we see extreme behavior, that substance abuse is involved with it?
Oh, absolutely, especially alcohol. We have a lot of people that maybe when they're not drinking or using drugs, that they can think a little bit more clearly and maybe wouldn't do the things, but once they get the substances in their body, that they might go ahead and do something that they've had a fleeting thought about over the last few months. So we absolutely see, a connection between substance abuse and suicide.
And it's one of those things that you can't necessarily arrest our way out of. One of the things I think has been going on for years, even decades, laws in place, and this is illegal or that's illegal, but it continues to flourish, it continues to grow. So there's a need for us to look at it on the front end and deal with mental illness as a disease of the brain and function and bring that person to some assistance early on.
And I think that's a nice correlation with crisis intervention teams that have been spreading across the country for law enforcement. It's a 40-hour intensive training on mental health and substance abuse issues for law enforcement. So they're more aware of what they're dealing with, and they can refer folks that are primarily having mental health problems to Eastpointe, to Mobile Crisis. We work very closely with CIT, crisis intervention law enforcement officers, to help make sure that we're not just funneling people into the criminal justice system when really treatment would be more effective for those folks.
Yeah, and we have a lot of upcoming CIT trainings coming up through Eastpointe, and our goal is to get as many officers trained in our area because, like Angela said, we see such a shift of people that are going to jails and prisons that really have mental health and substance abuse issues that have never been addressed and could, maybe be in the community if they had the right resources.
Absolutely. Quick wrap up, about 15 seconds. We'll start with you, Angela.
Call Eastpointe at 1-800-913-6109 if you have questions about mental illness, mental health, where to get help. If you need Mobile Crisis, certainly give Eastpointe a call.
And you can also go to our website, www.eastpointe.net, and get some more information about the services that we have available in the community, including Sampson County. We have service providers in all of our areas, and if you give us a call, we can get you an appointment set up.
I want to thank each and every one of these folks for being with us today. Courtney Boyette is contact information. You've got Kathy Baker with us, the communications officer with Eastpointe, and of course Angela Inman, the person that's in the field, on the ground, doing the job. This is a very heart-wrenching program. We're all saddened, and as the headlines and just about everywhere I've seen says, we are all heartbroken. Ladies and gentlemen, you've been watching We Should Know, Star Vision TV, WCLN Worldwide.
Thank you for tuning in to this week's episode of We Should Know with host J.W. Simmons. If you have a question or comment regarding this or any episode, please send your email questions and or comments to jwsimmonsedu@gmail.com. And remember to tune in every Tuesday afternoon beginning at 2:30 for another informative episode of We Should Know.